18F, 18M, my boyfriend won't get the surgery he needs for his dick. We've been going out a year and a half now. One thing with my boyfriend is that his dick, or specifically the band on the back of the head, the frenulum, frequently tears. When we first started having sex it would tear in any position. But now he goes extra gentle, which gets annoying. And it's fine, but when I ride him there's a good chance it tears, so I have to feel bad every time I want to go that. And every time it happens we have to wait a week or two for it to heal before he can use it again. There's seriously like a 30% every time I ride him it'll tear, and a 510% that if he's doing it'll tear. I googled and there's surgery you can get to lengthen the band so it stops tearing. But apparently there's a slight chance it'll reduce sensitivity in the dick because the frenulum is pretty sensitive. He said he's not losing feeling in his dick so he won't get it. I asked what he plans to do then and he said nothing. Like literally he plans to do nothing. He should see a urologist for the most accurate information. As mentioned elsewhere in this thread, the scar tissue buildup plus infection risk from repeated tearing is going to be worse for sensation loss than the procedure itself. I had an ex with this issue. I'm not a doctor nor do I have a penis, but I would imagine that the scar tissue from repeatedly tearing it would have a bigger chance of him losing sensation. I would frame this conversation as coming from concern about his health, not your sexual desires. Suggest he speak with a doctor if he hasn't already so he can be fully informed. Not just about if he is a candidate for the surgery, but if there are alternatives to surgery, and the possible long-term effects of foregoing treatment. Offer to go with him if it would make him more comfortable. But don't insist on being there. Or help him make a list of questions to ask so he doesn't forget again, only if he wants the help. If he ultimately decides not to see a doctor or not to have the surgery, it's his choice. If his frenulum tears a pretty high percentage of the time you have sex, I feel like the issue would eventually become more medically concerning as time goes on. I can't imagine it's good to tear yourself that often even if you take a break for it to heal. For starters, he's at risk of infection whenever it tears, and I just don't think that a dong infection is the greatest time. I don't think he should get surgery so he can bone you more often. But I do think he should at least see a doctor because he has a medical problem. Has he seen a urologist for the frequent tearing? If not, he needs to. That cannot be healthy, and there could possibly be an underlying reason for the tearing. A urologist could find alternatives that may help reduce tearing pain and increase the frequency of sex without surgery. Too many comments are missing the point, which is that Op is basing this entirely on having Googled it. He shouldn't get surgery because he hasn't had surgery recommended by a medical professional. What he should do is see a doctor about the issue and get professional advice and discuss options. He's already losing feeling in his dick for the weeks he has to wait for healing. You don't have to stay with him if this is a deal breaker. But you can't make him get penis surgery. Don't expect anything from him. This is how it will be from now on. Well, you don't get to tell him what he does with his body. But you do get to decide that his issue is one you do not want to continue dealing with. Clearly he does not want to have surgery, so your options at this point are to deal or to break up. I experienced this once and it was traumatizing and painful. I also didn't want to do surgery, but did a lot of Googling to see other options. Guide him to frenulum, foreskin stretching in a warm shower, and with using national coconut oil, vitamin E oil. After consistent stretching it shouldn't be an issue. Ultimately, it is his penis and his choice. You can choose if it is a deal breaker for you or not. You can't Google it and decide he needs surgery. You should encourage him to see a doctor if you're actually concerned about his health. But you seem to just be focused on getting off. Well, it is his dick, not yours. This is a medical issue. He should be seeing a doctor to at least have the issue assessed and be informed of his options. Personally, I would not have sex with someone if there was a pretty reliable chance that it was going to physically harm him. Stop having sex until he gets medical care or find someone else. I would not have sex with someone if their dick could rip open. Not as punishment for not getting the surgery. That just doesn't get me hot under the collar. Not sure how unique I am in this. I can't even believe I'm typing these words. He doesn't want the surgery, end of discussion. If this is an issue for you, you need to break up with him. I had a similar situation with a guy the first was seeing around 4 years ago for a few months. He had a very bad case of phimosis, so sex was painful for him and he couldn't use condoms. He didn't want to have surgery for the same reason as your BF. Fair enough. Your body, your choice. But I couldn't handle it and I just had to end it. Sexual compatibility and sex life in general is very important in a relationship. Edit. This dude had already seen doctors and decided he didn't want surgery. So I didn't pressure. Your BF should do the same before making any decisions. Personally, I would not want to have sex with him again. It would terrify me to the point I would never be able to enjoy the sex anyway. If he doesn't want the surgery, then you can't make him. You can choose if it's a deal breaker. If it isn't, then perhaps buy yourself some sex toys and just continue the relationship without sexual penetration of any sorts. Since neither of you are doctors, shouldn't you ask a medical professional instead of Googling and guessing? Scar tissue from repeated tearing plus the risk of infection causing damage seems like it has a pretty strong chance of reducing sensitivity, affecting his sex life in the long run. 2. He should really see a urologist for an accurate medical discussion of his options, the risks and rewards, versus just consulting Dr. Google. Repeated tearing can cause irreversible damage to the nerves and/or blood vessels. At the very least, he should consult with a doctor on his options. BC what you two are doing is not sustainable and risking his health. Good luck.
If you enjoyed this video, please check out our playlists full of similar content. Epic Ericast is like doom scrolling for your ears. Please like, share, and subscribe.